What is universal health care? When we begin thinking about universal health care, a definition is important. It involves coverage and access to health care regardless of one's financial status. The goal being to ensure that everyone in a particular community has access to necessary medical services. The background for universal health care is very rich. People don't always understand that it goes back to the 19th century. It goes back to the beginnings of industrialization, urbanization, and the transformation of the health environment. After World War II, the United Kingdom, for example, implemented a comprehensive national health service known as the Beveridge model. This really led to the creation of the National Health Service there in 1948, a tax-funded public health care service that was free for citizens and permanent residents. And with the success of that model, you see it expanded in Scandinavia, where versions of this Beveridge model were developed. Subsequently, the Canadian model in the 1960s developed until we are here today in 2023 in the United States discussing the advantages and disadvantages of this system. Why is it important? Well, there are many different reasons to think about the importance of universal health care. There's basic human rights, the right to health that we could be thinking about. We could think about the role of solidarity and social cohesion, so that a community, a society, a country fosters a sense, right, of social solidarity around the benefits of the healthcare system itself. Probably most widely understood are the benefits for equitable access to healthcare, and then the reduction of health disparities, and just the general improvement of public health outcomes. That is, the reduction in infectious disease, the ability to address various kinds of chronic conditions early, and the development and promotion of healthy lifestyles in the country. Despite the term universal health care, there really are a number of different models for what that health care would look like. You have a single payer model, where a single government managed fund is responsible for financing all necessary health care services for the population. And in this sense, we could think about the Canadian universal health care system. There are multi-payer models where multiple entities, including both public and private insurance providers, contribute to the financing of healthcare services. And in here, we could think about Germany as an example that has both what we might think of as a universal healthcare system, but it has also private healthcare systems available for citizens who can afford it. There are nationalized models where the government owns and operates all of the healthcare facilities and is the main employer of healthcare professionals. And nationalized systems where the government owns and operates healthcare facilities and employs healthcare professionals, we can think about the United Kingdom. So what would be the advantages of universal healthcare system? There's the improved outcomes that we mentioned. That is the reduction in disparities, greater preventative care so that illnesses are treated before they become more serious and expensive to treat, earlier intervention services that likewise prevent illnesses becoming serious and requiring complex and expensive interventions. Equity, of course, is one of the advantages, probably the best known advantage of universal health care, that the financial hardship of illness for lower income groups can be reduced. Lower income groups that become bankrupt, let's say through the financial hardship related to illness, can be avoided. And the cost efficiency is also an important one, so that universal health care can reduce costs, that can streamline the administration, can develop a larger economy of scale and bulk purchasing for healthcare commodities, and can really reduce, as we said, the serious and expensive treatments, thus making things more affordable. There are many comparative studies which have illustrated this particular phenomena. Countries with universal healthcare systems, well-known systems such as in Scandinavia, Sweden, Norway, Denmark, perform better in terms of health outcomes and equity, and they spend less overall on their healthcare systems as a percentage of their GDP or gross domestic product. These are very efficient systems that provide extensive preventative care. They do not allow pharmaceuticals to be on the market, and so you don't have profits that are built into the cost of the pharmaceuticals. Research and development is included in the cost, but not profits for things like shareholders and CEOs, thus making the pharmaceuticals more cost effective. But of course, like any phenomenon, there's also disadvantages to universal healthcare systems. So we can think about the disadvantages around financing. When you create a universal healthcare system, you need a upfront investment of resources, a very significant upfront investment of resources to build the system. And it requires great planning for the system to maintain sustainability through the long term. Particularly, that allows it to weather the economic ups and downs of market economies. Resource allocation is also one of the areas that we can think of for disadvantages. So in terms of the United Kingdom, for example, there are many issues around resource allocation. If we look at the United Kingdom for this issue of resource allocation, it is the case that the most expensive interventions, the cost of the administration of the system, and then waste within the system really serve to kind of undermine sustainability. There are many inefficiencies that the National Health Service there in the UK is working to eradicate. Of course, politics are also a disadvantage. When you're talking about tax increases for financing, when you're talking about changes to an existing healthcare system, that can produce great public and corporate resistance. Particularly if you think in the United States, one of the biggest forms of resistance to development of a universal healthcare system is from the biomedical and technology industries. So to conclude, two things to really consider in summarizing this issue of universal healthcare. The first is that it's a really broad concept, but with that breadth comes a large variation of different structures and mechanisms. So there isn't one such thing as universal healthcare. There's a lot of different ways that a community, a society, a country can develop a universal healthcare system. But like anything, there are trade-offs, right? There's the advantages of accessible and affordable healthcare services all, but as we've seen, there are various challenges and considerations in implementation. Issues around cost, administrative complexity, resource allocation, as some of the examples that we've seen.